Hello, my name's Joy Bichon and I'm CEO of Healthwatch Greenwich. Healthwatch Greenwich is one of 148 Healthwatch organisations around the country. The Health and Social Care Act 2012 introduced local Healthwatch as well as Healthwatch England, which is the national umbrella body. Together, we exist to represent the consumers of health and care services. Healthwatch Greenwich is a local, independent service which exists to speak up for local people on health and care. Our role is to make sure that the health and care system in Greenwich reflects local people's expectations and needs. We will listen to your opinions and your experiences of health and care services, and we'll feedback your views to the people who plan, pay for and deliver health and care services. We can help you to find the information you need about a local health or care service, or point you towards someone who can help you if you need support to raise a concern or make a complaint about a service. We're independent from the NHS, we're independent from the local authority and from other local health and care services, so people can talk to us about whatever they like, confident that we will support them. And all the information we receive from you is confidential. Healthwatch Greenwich exists to fulfil the statutory functions of a local Healthwatch, and these functions can be broken down into engaging with local people about health and care services and promoting their involvement in all areas, monitoring the quality of health and care services, using the voice of local people to influence commissioners and providers, and providing information and signposting services for local people so that they can make choices about health and care services. We rely on your input. We need your input and feedback to guide us and guide local planners and providers of health and care services. Local people are encouraged to come to us to identify areas of concern and areas of good practice so we can bring these to the attention of local providers of health and care services. You can contact us by telephone, email, social media, letter or attendance at local events. We'll always be interested in what you have to say and we're always here to listen. In the light of the coronavirus pandemic, we've changed the way that we work, and we're not alone in this, and we know that all local Healthwatch have shifted their focus at this time. So in line with government advice, we've cancelled all our outreach and any physical public-facing meetings and our enter and view visits. And in addition to this, all our staff and volunteers are now working from home. We've refocused our energy to do what we can to support local people in Greenwich. So we've used our office mobile number as a contact for members of the public requesting support from the Greenwich Mutual Aid Group. We've been answering calls coming into that number, triaging and recording details, completing appropriate forms and forwarding them to the most appropriate people who can help those seeking support. We've been using our website and our social media channels to signpost the government advice and local support mechanisms for vulnerable people and for those who are self-isolating. And for those who are lonely and lack social contact, we offer a friendly voice and reassurance over the phone. As the situation progresses, we will continue to do all we can at Healthwatch Greenwich to support local people.